Okay, we're going to talk about a seizure medication today. This medication is known as Divalproex. This medication was originally developed as Depakote, but wasn't very well received, and so this form Depakote is a form that is better received and works a little better for a lot of patients. Okay, so again, the medication is Divalproex, also known as, by its trade name, Depakote. Okay, you're going to be tested on this medication often. It's something that you see a lot of test questions on, and there's a couple of reasons why. But first of all, let's talk about the indication. We discussed it's good for seizures, manic episodes. It can also be given for migraine prevention. Okay, the way that it works is it increases the level of GABA in the CNS. Now, what GABA does is it's a chemical that blocks electrical signals in the brain, okay, basically. So by increasing those levels of GABA, we can then help to prevent these seizures, right? Because seizures are basically uncontrolled electrical signals firing all over the place in the brain, depending on the type of seizure the patient has, whether it's local, focal, or generalized. But basically, by increasing these levels of GABA, we can then decrease that electrical activity and help to control seizures, hopefully. Depakote also reduces the amount of chemicals in the brain that excite these nerve cells. Okay, and so by doing those two things, we can hopefully control seizures. Now, one thing to keep in mind here is that it doesn't work like as fast as so it's given to control seizures over the long term. It's not given to stop a seizure. Okay, so for like a patient who's having a seizure, we're going to give like the Ativan and the Valium. Now, for a patient who has a history of seizure disorder, we can then place them on like a Depakote to try to control these seizures. Okay, so therapeutic class is anticonvulsant and vascular headache suppressant. Okay, pharmacologic class is none. Okay, so some really important things to keep in mind here. One thing you're going to want to keep in mind is it can decrease platelet levels. Okay, so it can take longer for the patient to stop bleeding. So especially for like a patient who's on like a Warfarin, we really need to keep in mind that it increases the risk for the bleeding in these types of patients. Okay, it can also cause suicidal thoughts, agitation, dizziness, insomnia, hepatotoxicity, and pancreatitis. Okay, keep that in mind that it can lead to this inflammation of the pancreas. Okay, so you watch your patient for stomach pain followed by nausea, vomiting, and knowing that this medication can lead to pancreatitis is very important to understand. We're going to want to use caution with a patient who takes MAOIs. Okay, big things I want you to keep in mind is kind of what it does. Okay, it's going to increase our levels of GABA. We're going to be giving it to control seizure activity. Okay. Now, we'll use it with other medications, right, like Tegretol, Dilantin, phenobarbital, and that can increase the response of this Depakote. A couple other things I really want you to keep in mind here. You want to monitor your liver function tests. And then with this medication, with our seizure medications, in order for the medication to actually work, we really need like a serum level that's within therapeutic range, okay? So whether the Dilantin levels, we talked about that with Tegretol, and with Depakote, it's the same, okay? We want to monitor our patient's level of this medication, okay? So we want to monitor lab values to make sure that we're within range for this patient, okay? And that's really kind of what you need to know about Depakote. Remember, the trade name or the generic name is Divalproex.
This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.